Welcome to Logical Ayurveda. Today we are discussing about tennis elbow and its management. This is one of the common condition where Ayurvedic practitioners come across in their day-to-day practice. We will see what is tennis elbow first. It is a condition which is characterized by a painful inflammation over the outer part of the elbow. Tennis elbow has got one more name. It's also called as lateral epicondylitis. This condition occurs due to the overexertion. The tendons in the elbow become inflamed and it causes tennis elbow. So, for the better understanding, we must know the anatomy of the elbow. We know that in the elbow joint, lower part of the humerus is present. There is a bony protrusion at the lateral part of the humerus, which is called as lateral epicondyle. Some of the tendons and ligaments of extensor muscles of forearm are attached at the lateral epicondyle. So mainly this helps in the extension of the forearm. So when these extensor group of muscles are used in excess, that causes tennis elbow. So that is why it is most commonly seen in the tennis players. Now coming to the symptoms, pain is the main symptom of tennis elbow. This pain aggravates by touch. So when we touch the lateral epicondyle, the pain aggravates. So as in Ayurvedic term, it is called as sparsha asahishnuta. That is the tenderness of the elbow. And also there will be weakness of the hand, mainly in gripping the things we can see. So these are the main symptoms which is seen in tennis elbow. Now let us discuss this condition as per Ayurveda. Do you know that our legend cricketer Sachin Tendulkar was suffered from tennis elbow and he lost so many matches because of severe pain due to tennis elbow. As we discussed earlier, it's most commonly seen in tennis players, but in this tennis there is a shot called backhand. In backhand mainly extensor muscles are used more. So continuous usage of these extensor muscle cause inflammation. So we can just tell that the nidana is ati vyayama here. Or it can be due to abhigata also. And about the sthana, that is lateral epicondyle, that is in the elbow joint. So lateral epicondyle is considered as asti and elbow joint it is sandhi. These extensor groups of muscles which are attached are considered as mamsa. So the ligaments attached are snayu. So this is just like a marmasthana. That is asti, sandhi, mamsa, snayu, sannipata is present here. So it is a marma only. So now coming to the lakshanas. So as we have already discussed in earlier itself, main lakshana is sparsha asahishnuta. So this is the typical lakshana of tennis elbow. So this lakshana shows the involvement of rakta. In the classics also it is mentioned that whenever there is rakta dushti, there will be sparsha asahishnuta. Now let us talk about the involvement of the doshas. This is the disease caused due to ati vyayama. So the dosha involved here is vata and pitta. As pitta is there, we can also consider the involvement of rakta also because of ashraya ashrayi bhava. So mainly vata, pitta or rakta causing this disease tennis elbow. Now coming to the chikitsa part, as we discussed in our previous videos, in vata and pitta involvement we should do brahmana chikitsa. But here we should give little bit of shofahara chikitsa also, since there is a shofa or inflammation present. So we can classify chikitsa into bahya chikitsa as well as abhyantara chikitsa, external as well as internal therapy. In coming to the bahya chikitsa, we can use upanaha as treatment. Upanaha is considered as one of the best and effective treatment in treating the tennis elbow. So we can use Nagaradi Churna as lepa. We can tie it on lateral epicondyle area and keep it for 1 to 2 hours and then just wash it off. This is also very best lepa. And there is another folklore practice where they are using tila powder, which is mixed with the kshira, milk, and make it a paste. Then apply over the affected area and do bandaging. This is also very best effective treatment in treating the tennis elbow. We know that in tennis elbow, asti involvement is there and there is involvement of snayu. So, Brahmana Chikitsa is best here. So, this tila and milk combination gives sufficient Brahmana effect. So, this is one of the best treatment. So, these about the Upanaha as Bahya Chikitsa. Another very important and effective treatment in treating tennis elbow is dhara or seka to the site. For dhara, we can use any shofara oil like Murivenna Taila. Murivenna Taila, it is a very famous oil used by many Ayurvedic practitioners in their day-to-day practice. And we can also use Balalakshadi Taila, which is also very effective in treating tennis elbow. Now about Agni Karma. Agni Karma is also considered as very effective treatment in treating tennis elbow. Why? Because in tennis elbow there is severe pain is there. So severe pain is considered as the typical action of tennis elbow. So this Agni Karma which helps to relieve this pain. So this is also considered as the effective treatment in treating the tennis elbow. Now coming to the Abhyantara Chikitsa, like Bahya Chikitsa, the internal medications also plays an important role in treating the tennis elbow. So one of the very best and effective medicine is Bala Guduchadi Kashaya. So it does have the Brahman action as well as Pittahara action. Why? Because Guduchi is present, which will subside both Vata and Pitta. So it can be prescribed in tennis elbow. Now another Kashaya is there, which is very famous Kashaya used in Kerala. Whenever there is Abhigata or Dhatukshaya or involvement of Marma is there, this Kashaya is used. That is Musta Marmadi Kashaya. So this is a very famous yoga. Now coming to the tablet formulations. We can use Lakshadi Gugulu, Gokshuradi Gugulu as well as Kaikshura Gugulu. These are also very effective in treating the tennis elbow. So coming to the conclusion, the disease tennis elbow or lateral epicondylitis caused due to overexertion, or we can tell it is due to Ati Vyayama. So the dosha involved here is Vata along with Pitta or Rakta. Main symptom is pain which aggravates by touch, that we can call it as tenderness over lateral epicondyle or Sparsha Saishnuta. So the Chikitsa Sutra or line of management is Brahmana and Shofahara Chikitsa, that is both in the form of Bahya as well as Abhyantara Chikitsa, which will help to subside Vata along with Pitta and Rakta.